So if you see here, the topic PIBD, that is prolapsed intervertebral disc. We will be continuing with the orthopedic chapters, and then I'll switch on because for neuro chapters, I think it may be covered by someone else. If not, then I will continue. So prolapsed intervertebral disc, PIBD. So in common man terminologies, if you see, it is also called as what? Do you know the name of another terminologies for PIBD? Any idea? Hmm? What is the other term? No idea.
No.
So sleep disc, yeah. So a prolapse disc is commonly known as the sleep disc, where actually, you know, the disc does not actually sleeps off, but the part of the inner softer part of the disc bulges out or herniates out through a weakness in the outer part of the disc. So it's called herniation of the inner softer part of the disc. So that inner softer part is called nucleus pulposus. We will be coming in the later slides. So that particular portion comes out actually when a nerve is compressed or when the this lumbar region of any part of the spine is getting compressed. And as it is getting compressed, it is becoming weak. So this herniation or the bulging of the disc occurs. So now the prolapse intervertebral disc is another term is also called as herniated disc. So you got three terminology. One is the prolapse disc, another is the slip disc, another one is the herniated disc. Is it clear? The definition?
Yes, ma'am.
Okay. Next is, you see here, basically this disc herniation, it covers or it occurs in 4 stages: degeneration, prolapse, extrusion, and sequestration. So first is degeneration. You can see here, it's a small part of the inner pulposus which can be seen. Now you can see, you know, you have studied uterine prolapse. So what is happening? So it slowly, the as it is extended, it try to come out from any uh, portion of the body. So it's herniation occur, and then extrusion. So any part which becomes weak, it comes out through this part, right? And as it is getting compressed, it is coming out through this part. Then is the sequestration. The weaker portion, it get more of weaker, and due to that, you can see here the weakness, it extends, and next is the herniation become so extensive, and then the leakage started occurring. Because of this degenerative portion, the leakage started occurring from the area. But don't think that leakage will be external, it will be internal only. Internal, the inner nucleus pulposus, it started herniating or it started moving out from the actual space. And when it started moving out from the actual space, it compresses the nerves. So when it starts compressing the nerve endings, so that is the reason, like the pain, the nerve endings, we know that from that this one sympathetic nervous system, it's try to send the pain signal to the brain, right? And due to that, when the nerve endings are blocked, when the nerve endings are getting compressed, the pain signals getting initiated more, and then what happened, the patient started complaining of pain, which is the which is the most important part in this particular PIVD. Pain is the most important clinical symptom which can be exhibited by the patients when suffering from PIVD. Clear? So these 4 stages you try to remember. One is the degeneration, next is the prolapse, third is the extrusion, and sequestration. Okay, got it?
Yes, ma'am.
Yes. Now,
Yes, ma'am.
yeah, the more explanation of the 4 stages. Now you can see here bulging. At this is the very early stage. The disc is stretched and does not completely return to its normal shape when pressure is relieved. It retains a slight bulge at one side of the disc, Some of the inner disc fibers could not be torn, and the soft jelly, as I was mentioning, it is termed as nucleus pulposus. It's splitting outwards into the disc fibers, but not out of the disc. So you can see here, it is only fixed into the disc fibers. These are all disc fibers. Okay, it is stuck into the disc fibers. It is not coming out, but already the bulging, right? The bulging started occurring here in this degenerative phase or degenerative changes. Next is the protrusion. At this stage, the bulge is very prominent, and the softer jelly center has spilled out to the inner edge of the outer fibers, barely held in by the remaining disc fibers. So now you can see here prolapse or protrusion. It started coming to the very edge of the disc fibers. These are all disc fibers, as I mentioned. It coming to the edge of the disc fibers, and just after some time, when there will be more pressure, right, more extensive damage, then extrusion and sequestration will occur. Now, what is extrusion? In the case of herniated spinal disc, the soft jelly has completely spilled out of the disc and now protruding out of the disc fibers. You can see here in this picture. So it started coming out from the inner edge. Here in prolapse or protrusion, it comes up to the edge. Now, once this is more extensive, it try to comes out, spilled out of the inner edges as well of the disc fibers. That is what is the extrusion. In case of herniated spinal disc, the soft jelly has completely spilled out of the disc and now protruding out of the disc fibers. And the last one is the sequestration. Here, some of the jelly material is breaking off away from the disc into the surrounding area. Prolapsed disc, commonly called as slip disc. A disc does not actually slip, right? So again, you see here, you can compare from this picture the weaker part, how it got affected, and then through the weakness, the total slip actually does not. The disc fiber is intact in the space, but only the softer jelly, it becomes slip off from the area or from its original place. Am I clear to you? The stages? Yes? Please tell
Yes, ma'am.
me. Yeah, respond.
Yes, ma'am.
Now, what happens is that part of the inner softer part of the disc, that is the, please try to remember this terminology. This softer jelly, it is called as nucleus pulposus, which actually bulges out or herniates out through a weakness in the outer part of the disc. A Pivd or prolapsed disc is sometimes called as the herniated disc. The bulging disc may press on nearby structure such as nerve coming from the spinal cord. As I told you, that it is compressing the nerves which is surrounded by this nearby disc, nearby the spinal, these nerves which are connected with the spinal cords, and which is absolutely been compressed, and that is the reason that the patient complains more of pain. Some inflammation also develops around the prolapsed part of the disc. Any disc in the spine can prolapse. However, most prolapsed discs occur in the lumbar part of the spine. So, most of the patients, if you remember, you have witnessed, or during your BSc time, you have witnessed, or during your when you were working as a staff or teacher, you have witnessed that most patients complains of the slip disc in the lumbar area. Cervical slip is very it's not that common. It is there, but it's rare. But mostly it is due to the, it is occurring, the disc prolapse occur in the